Thanks for watching TMA's Legislative News Hotline for Sunday, June 25th. I'm Brent Anier. This week on Hotline, we continue our 5-part series examining major issues addressed this session. TMA Legislative Affairs Associate Director Clayton Stewart joins us in a moment to discuss the major health insurance legislation lawmakers passed. We cover an improvement to the mediation process to address surprise bills caused by inadequate insurance networks. We also take a look at other TMA-backed bills, including one dealing with step therapy override and how TMA advocates played defense to protect some bills important to Texas medicine. We appreciate Clayton joining us to talk about the bills that you worked on this session, many of which were insurance related. And of course, we know one of the biggest insurance issues we faced going into the session was inadequate networks and the balanced billing that often results from patients getting care outside of network. The first one I want to talk about was successful, and it expands mediation in those cases, right?
Absolutely. Senator Hancock and House Representative John Frullo were very helpful and have worked on this issue for a while. And we are seeing more and more narrow networks from the insurance company across the board. All insurers are creating more narrow networks in order to help their bottom line. And the patient is the one that ends up having to foot that bill. And while they don't necessarily blame the physician for that, the patient doesn't blame the physician, they do want the physician to fix it because they do trust their physician. And part of the TMA solution that we put forth was expanding the current mediation process that is in place if you do get a balanced bill. So this session we supported legislation that basically expanded that mediation process to all healthcare providers that are at an in-network facility and all emergency care. Really trying to make a strong effort to help the patient and allow the physician to maintain their right to get paid for what they're providing to a patient.
That's where a lot of these happen, right? You think, oh, I checked and my hospital's in my network, my insurance coverage, so I assume as a patient that everyone there is covered.
Absolutely, absolutely. It's a major issue. And another piece of legislation that we worked on was, asking insurance companies or forcing them through law to basically update their directories more regularly. And unfortunately, that bill didn't make it across the finish line, but that is something that we will continue to push and that we think that there's a lot of traction for within the legislature in order to help patients make the best decision possible when seeking health care.
So there was a lot of discussion about the role freestanding emergency rooms play in this. What happened this session with regard to those?
Absolutely. Freestanding emergency rooms are really a new platform to provide more access to care across the state of Texas. And one of the concerns that has been addressed or that has come from patients is being surprised that they're actually in an emergency care facility and that the facility fee actually increases in those facilities versus an urgent care facility. And so the mediation bill did address emergency care across the board to include freestanding emergency facilities. But in addition to that, Dr. Tom Oliverson, who is a newly elected state rep, filed legislation to basically provide for freestanding emergency facilities to post a disclaimer of their basically what networks they are in for insurance and that they are an emergency care facility versus an urgent care facility. So really something to help educate a patient when they're making a decision on where to seek care.
So both of these are really, well, of course the mediation just broadens or empowers patients in that situation, but the other one is patient information, helping them understand their insurance.
Absolutely, and that's really the goal, and I think in the state of Texas, what we need, and with the complicated insurance system that we have, even nationwide, is that we need to make sure that we are doing everything we can to educate patients as consumers on the product that they're buying, and at the same time, hold the insurance companies accountable for the product that they are selling to these patients.
Great. So another one that is kind of insurance, or what is insurance related, but it fascinates me, and that's the step therapy override issue.
Absolutely.
What happened with regard, what was the problem and what was the solution from this session?
No, absolutely. Step therapy is basically a process by which, you come to me as a patient if I'm a physician, and I'm going to write you a prescription for a medication that I think best suits your needs. Well, the insurance company or the pharmacy benefit manager of the insurance company says, we are not going to let you use that prescription until you try a lesser cost prescription. And if you fail on that, we will then bump you up to the prescription you need.
Regardless of what the physician thinks is medically necessary.
Absolutely. The physician's pad in this situation is more of a suggestion pad. And that was something that we felt was a real problem, that Senator Hancock felt was a real problem, and Representative Dr. Greg Bonin felt was a real problem. And we worked very closely with groups like the Multiple Sclerosis Society to help address this issue. Right now, if an insurer does push a patient to a step therapy protocol process, the physician does have the right to request an override. Well, part of the issue that we were experiencing in the medical world is that it was taking up to 53 days for that override to even just have a judgment on.
Wow.
And what Senate Bill 680 does is bumps that to 3 days of making that determination so the patient knows what they're going to have to do.
This next one, it seems like it's something that might affect a really broad number of patients. And that's the prescription copay thing, where it's possible that I, as a patient, depending on my insurance coverage, my copay might be more expensive than I just paid for the medication?
Absolutely. A lot of times, especially in the case of a generic, you might go in and it might be a $5 prescription, but your copay is $25. And what Senate Bill 1076 did by Senator Charles Schwartner and Dr. Greg Bonin filed the bill basically saying that if your prescription cost is less than your copay, then you pay the lesser, which is really just common sense and really helping the consumer out. And there's no reason to pay that copay if the amount is less. Additionally, some other language got amended onto that bill, the wonderful process that we have in the legislature where amendments can really take a life of their own, but made it easier to refill your eye drop prescription. Eye drops are among the most wasted or accidentally wasted prescriptive medicine out there, and absolutely spill it or miss your eye or whatever it may be. And so basically it made it much easier for you to go refill your eye drop prescription with not receiving a penalty from the insurance company.
The next one I want to ask you about is also prescription related, and
Absolutely.
That's syncing your medications. What's the scenario where this comes into play?
No, absolutely. A lot of times you have patients that are on multiple medications because of chronic illness, and basically they're making several trips to the pharmacy throughout the month to refill several prescriptions. And basically what House Bill 1296 did by Representative Frullo and Dr. Don Buckingham, who's the senator that carried the legislation, basically it allowed for a pharmacist to help, with the assistance of a physician, sync that medication so that it can all be picked up at one point in time. And really it provided that there could not be a penalty or loss of coverage from the insurance company in order to sync those prescriptions. So really making it easier on the patient to manage their chronic illness.
Let's shift gears just a little bit. So I know you're into sports. You probably know there's a sports adage about sometimes the best offense is a good defense.
Absolutely.
And we had to play some good defense on a couple of bills.
I've worked 6 legislative sessions, and this was probably the most aggressive defense I've had to play as either a Capitol staffer or a lobbyist. And so it was quite crazy. But one thing I will say is that physicians' ability to get paid really was threatened this session. And there were 2 bills that aimed to threaten that. And both of them were basically saying that you could not get paid for a balanced bill, in essence. And in one of them, there was a heavy transparency piece put in, and it was House Bill 4011 by Dustin Burrows that said, if you don't give an accurate upfront price estimate, you are not allowed to bill for those charges. And the way that they did that was saying that you could not send that to a creditor. And so if there's no teeth in being able to collect on a bill, you're not going to get paid. Right. So you could bill for it, but there was no incentive for a consumer or patient to pay. And physicians
singling out medicine,
no other profession, and actually singling out physicians more than anything, not hospitals or any other healthcare provider. While price transparency is something that a lot of physicians are evaluating and looking at implementing in their own practice, putting it in place in a way that affects the way a business is run is not okay. Right. And this bill actually made it all the way to the House floor, which at that point you're no longer working 10 to 15 votes in a committee, you are working 150 votes on the House floor. And this is really where TMA's relationships came in, and we won that vote, I believe, 97 to 35. Wow. So it was quite a victory on the House floor to go through an up-down vote and defeat basically this idea that we shouldn't be able to bill. And I think a lot of the business members of the House really saw this as is this opening the can of worms to where my business is next, and where's that freedom of being a business person in the state of Texas going if we do this. So we saw another bill similar from Senator Larry Taylor that just said you couldn't send a balance bill to a creditor if it wasn't paid. That was something that we ended up stopping in committee in the House with good friends like Jason Villalba and Ramon Romero, both state representatives from North Texas who are extraordinarily helpful and really took a strong stand for medicine. But really some of the most stringent defense we've had to play in a while, and it directly was something that affected physician pay. So really, the thanks goes to the lobby team, the relationships they have, but even more so our physicians and the relationships that they've built and the involvement that they have in TexPAC, helping these people when it really matters. That all comes back around like we've been saying, and this is a great case for it.
Upstream, from before
Absolutely.
session started, relationships in the district.
Those relationships really made a big difference, and we want to maintain those relationships and keep moving forward with them, because when we get into these defensive positions, that's when those relationships, in my opinion, really come into play.
You alluded to this, last thing I want to ask you, you alluded to this just a minute ago, but what was your take on the overall tone of this session?
It was a very different session. I've worked 6 sessions, and this was probably the meanest session I've ever been in. Just very different kind of tone altogether, and I think part of it was the 3 big leaders, Lieutenant Governor, Governor, and Speaker, were maybe policy-wise on very different pages this session, which can happen. There's nothing wrong with that, but it can sometimes create some consternation amongst the chambers. But really not a lot of bills passing. I'm very thrilled that we were able to pass the legislative package that we did, but really just a hard session on everyone involved and just very, very unique.
Wow. Well, and I know the physicians, thank you for all your efforts, and as you said, in turn, we thank the physicians for their involvement.
Absolutely. We could not do it without them.
Thanks again to Clayton for joining us. Next week, Dan Finch, also of TMA's advocacy team, joins us to analyze some of the items he worked this session, including the landmark bill to solidify the practice of telemedicine in Texas, plus some scope of practice issues and more. A reminder, please check out TMA's YouTube channel for our earlier installments in our video series detailing what passed and what didn't this session. Last week's featured the budget, Medicaid, women's health, mental health, and graduate medical education, plus the maintenance of certification bill. That's it for this week. I'm TMA's Brent Anier. Thank you for watching, and please join us again next week for more legislative wrap-up on TMA's Legislative News Hotline.